Assalamu alaikum. Welcome to another edition of Ramadan for Better Health. Welcome to the program. As always, this is dedicated to improving and enhancing our knowledge and understanding of how the human body works in connection with nutrition and, of course, fasting during the holy month of Ramadan. For today's subject, we're joined by a clinical nutritionist and a gastroenterologist, Dr. Osama Fikri. Assalamu alaikum to you, doctor.
Alaikum salam wa barakatuh. Happy Ramadan again.
Thank you, and happy Ramadan to you as well. Today we're going to be talking about the environment inside the stomach or the gut. We're looking at how to, what to do about promoting a healthy stomach environment. You know, we have a great number of bacteria in our digestive tracts that we depend on for healthy digestion. But in some cases, we have people who have compromised the quality of the health in their stomach environment. And so the doctor is going to be talking with us on a subject of how to deal with this. Doctor, just give us an introduction about this subject of what kinds of conditions do patients have where they need to have interventions to improve the health of the stomach environment.
Okay, recently there are much research about the microbiota. The microbiota, as you kindly mentioned, are the bacteria that involves or inhabits the gut all through its length, from mouth up to the anal orifice. And surprisingly, we found that its number are 10 times our cells. Actually, there are 10 trillion organisms, bacteria. Meanwhile, our cells, number of our cells in the whole total body in a normal adult are 10 trillion. So you can do the math. Who is living with who?
Wait, so you're saying that the number, the actual count of the bacteria in the human stomach, 100 trillion.
Yes, 100 trillion.
Versus
microorganisms.
Microorganisms in the gut. Wow, that's amazing.
Yes.
And that's in one person, not for the whole world.
No, just no. This is actually inside the stomach. Actually, on the skin, in the hair, in the eye, in the other places there are more. And I'm talking just about in the gut.
In the gut.
From the mouth to the anal orifice.
100 trillion.
Yes,
okay.
100 trillion. Meanwhile, our cells are just 10. So we are living with them. What I'm saying that recently they are talking about...
Doctor, I'm sorry to interrupt you. We have a photo here about the hazards of luminal starvation.
Actually, this is from the Medscape online. Actually, it's talking about the how the changes in that gut bacteria, because, you know, we have a war inside, in between the commensals, the good ones, and the non-commensals, the bad ones. This war could sometime in the ICU patients when we keep them not eating for long periods of time, for long days of time, which is a common sort of practice in the ICU. This leads to destruction of that gut barrier, and this leads, those are the gates of hell. It liberates these microorganisms back into our bloodstream, which creates what we call septicemia, the involvement of bacteria in the whole blood. And usually, this is the cause of this of many patients in the ICU.
All right. So we're talking about people who are not eating.
Yes.
But this is different from fasting the holy month of Ramadan.
No. It's totally different.
Okay.
Yeah.
Yes.
Yes. Usually, the changes in the gut starts when we are keeping fasting totally, MBO, nothing per os, nothing per mouse, for more than 3 days.
3 days.
It's totally different from the caloric restriction at a month like Ramadan, especially when we are introducing our iftar in a very gradual manner from the time of iftar to suhoor. This could be like a fresh start in us in Ramadan, that we can eat the beneficial food that works on supporting our good bacteria, our good flora against the bad one.
Okay. All right. So we have a difference between people who are depriving themselves of food over more than 3 days.
Yes.
You're saying that there's a covering inside the gut that protects the bloodstream from these bad guys in the stomach, right?
Yes.
But if after a certain amount of starvation, they have more easy access into the bloodstream, right? But fasting Ramadan is a different thing entirely.
Yes, yes, it's totally different. Yeah. Uh,
Yes. Okay, so people who are in this situation, these ICU patients who have been starved or who are not eating for whatever reason, hospital or not, are they people who need some kind of remedy with the introduction of more good bacteria?
Yes, actually there's a photo of, I'm coming with in a electron microscopy, a golden one, showing this very descriptive. Yes, this is the one actually. This is the gut barrier we are talking about, and this is the mucosa that is covered, this layer, and this showed those shiny small golden ones are the bacteria shown by the electron microscopy, and this is when the patient is kept in BO for a long period of time, and it liberates back into the bloodstream. This is very descriptive actually. Yes, that's very true what you were saying, and nowadays in the intensive cares units we are fighting this, and we are telling that the doctors shouldn't keep the patient in BO for a long periods of time. Many doctors have many justifications for this. The patient is doing surgeries, the patient is for fear of gut rest whatsoever. No, the current evidence, the current recommendation is to keep the patient, if is not eating orally, we can use the tube feeding. We insert a trial tube back to his stomach or down to his stomach or to his intestine and start feeding him with an intra formula in order to prevent this.
All right, so can we talk about the microbiota?
Biota, yeah.
Biota.
Yeah.
What is microbiota?
Actually, the microbiota is a variable pattern of bacterial microorganisms distributed over the gastrointestinal system, from the early intestine up to down the jejunum, the ileum, the duodenum, and the colon, specifically to the colon. They found recently that the changes that happen in this environment actually could be reflected on many diseases.
So this particular bacteria, this is a type of bacteria, is that what you're saying?
Many types, actually.
Many types,
We have 300 to 1,000 different types, in which not all of them we are aware of.
All right, and they exist throughout the entire digestive tract, from the mouth
up to the inner orifice, yeah.
To the end. And you gave us the number, that their number is 100 trillion.
Microorganisms,
right?
yeah.
Are there only two kinds, good and bad, or is it diverse, different types with different functions?
Actually, there are many types. We have like from 300 to 1,000 different organisms.
Wow.
Yeah, but we are not aware of. This photo actually is also from the electron microscopy, but from a rat. And it's, as you see, it's a very definite line of demarcation, the gut barrier in between the mucosal gut barrier and the bloodstream outside. Because this should be intact all the time, because this, if it's leaking, it will liberate the hell. All these microorganisms could be liberated and consumes our immune system. By the way, that's why in the gut, which is surface area is 30 meters along, we have 70% of our lymphoid tissue. Lymphoid tissue, this is a very important constitute of our immune system, of our white blood cells. This is just because of this. Actually, we have 300. One of the professors in a conference, he told me that in their laboratory, when they discover a new species of that microorganism, they name it after one of his colleagues. But they don't know if this is a good thing or a bad thing, because later on, they don't know. Later on, they usually know if it's a bad microorganism or a good microorganism.
Okay. All right. So, doctor, you're telling us that there's a great number, an amazing, we're outnumbered by these bacteria, and there were 3,000 different types, did you say?
Actually, 300 up to 1,000.
300 up to 1,000 that we know of.
Yes.
All right. So we're talking in theoretical terms about all these processes and systems and entities. Let's make it practical for the everyday person.
Yes.
We're talking about eating healthy. How do we promote good gut health? What kinds of foods do we avoid and choose?
Actually, this is a very complex question.
Okay.
Okay, let me first define a pre-terms, okay? A terms, an important terms regarding this issue. First, we have the probiotic. Those are bacterial matters, bacteria that are introduced in some of the nutrients to help the commensal ones to increase their number, to help them against their fight against the non-commensals. And also we have the prebiotic. Usually, the prebiotic are the complex fibers that are non-absorbable. Non-absorbable or through the gut, and those act as a fuel substance for the commensal ones. The commensal ones.
They eat them.
They eat them. They live on them. Yes.
Okay.
Yeah. We don't eat them, but they eat them.
The bacteria eats them.
Yes. Yeah. We have the symbiotic. Actually, it's a mixture of both. Regarding the food that actually flourishes this and increases this, we have the fruits, the vegetables, the one that are very rich in fibers. We have a bifidogenic type. One of those bacteria are the lactobacillus and the bifidobacillus. They are the most famous ones. They are good ones, and they are now pre-prepared in many of the dairy products in the market. We have the dairy products. Yogurt is one of the products that we can help against as a prebiotic. Also, we have the prune. The
prunes.
Yes, the prunes.
Dried plums.
Yes, the dried plums, and we have it during Ramadan. We can use it. It's very beneficial. Actually, when we were back in Germany, we used to give when a patient is complaining from constipation, we used to give him prune first. Then we try laxatives. It's like a natural laxative. Actually, on the other hand, we have many factors we are doing every day. You know, recently they are talking with patients and asking them, do you have a normal delivery? Do you were born normally, or your mother had a section, a cesarean section?
Right.
Because this is the first stimulus regarding the gut bacteria composition from the very early life.
Very interesting.
Can you imagine that this would affect the born fetus or the born child, the born baby, all through his life?
Wow. Okay.
Yes.
This is a very interesting point, Doctor. It gives us a nice time to take a break. We'll hear more about the conditions that we're born in, right, and how it may contribute to the health of our guts. We'll take a short break and come back with the doctor.
Wherever you may be around the world, may the peace of ever-compelling Creator be unto all of you. To our Muslim brothers and sisters in faith, and likewise non-Muslims around the world, we bring into you, wherever you may be, the unique signs that Prophet, peace of Almighty Allah, Muhammad be upon him, taught the whole world. Oftentimes, we see some people reciting Quran over and over, but they, however, reciting it differently. People sometimes confuse, why is that? Why they're doing that? Why this Imam reciting this way and this reciting differently? And what is the meaning of the hadith? Quran has been revealed based on 7 methods. Do you know the depth of it? Do you know the real meaning of it? If you don't know, for the first time over there and here in Al-Huda TV, we're presenting to you. So be with us. I will be your host, Ukasha Kameni, step by step until you grasp all the information why we have 7 methods of recitation of Quran. Remain blessed. May Almighty Allah subhanahu wa ta'ala bless you and your family. Assalamu.
Assalamu alaikum. Welcome back to Ramadan for Better Health. We're talking with Dr. Osama, a gastroenterologist, about how to promote a healthy gut environment, a healthy stomach environment with the microorganisms. He's talking about this, and we'll continue our discussion. You were talking a little bit about how the conditions, the actual moment of our birth.
Yes.
Talk a little more about the importance of the moment of our birth, whether it's C-section or not.
Yes, sir. Okay, regarding the fetal gut, it's totally sterile. He didn't eat.
Sterile.
Sterile, it means it's completely free of microorganisms.
Sterile, okay.
Sterile, it's completely free, clean.
Sterile,
it's totally
okay.
free, sterile, yeah. When he's delivered normally, this exposes him to some, sorry to say, of his mother fecal matter, which is loaded with microorganisms. This represents like a nucleus of his future microorganisms and the pattern. In the other direction, on the other side, when he's delivered in a section, he's delivered from her pelvis, from her abdomen,
Right.
if I may say, from
Yes.
her, away from passing from this enough. Can you imagine that this could affect him, his clinical status, his health, all through his life,
Yeah.
especially regarding his chest? They found that the asthmatic children are those more of delivered with C-section. Those who were delivered with cesarean section are more prone to the development of IBD, inflammatory bowel disease, which are Crohn's and ulcerative colitis, are more prone to IBS, irritable bowel syndrome. Our message are to try to get to this, because this is our nature. We will have the microorganisms.
Yeah, we can't do anything. They were here, I think, long before we got here, before Allah put humans here.
Yes.
These bacteria were here. All right, so we were talking, we'll go back to another practical aspect of this for the common person. We were saying that they need to eat more fibrous foods,
Yes.
you know, fruits and this kind of thing. What about certain substances that we take, tablets? In particular, we're concerned about there's an abuse of overusing antibiotics.
Exactly.
How does this impact the health of the stomach?
Yes, of course, what you are saying totally true. From the main factors that this issue is arising, and we are now hearing about it, many of the literature. Last year, 2014, there are 1,000 scientific papers were introduced and published on the PubMed itself, just the PubMed, okay, regarding the microbiome and the microbiota.
Yeah.
This is maybe because the misuse of the antibiotic. The antibiotic is like bombing with the airplanes, okay? You are bombing the good guys and the bad guys. And the problem is, nowadays, when they bomb the good guys, which actually regarding our food habits and the unhealthy lifestyle, eating less whole grains, eating refined sugar, and these factors, actually they are few. So when you bomb them with the microorganisms, with the antibiotics, the antibiotics, yeah, it degenerates both of them. And this gives rise to the bad guys, the non-conventions, to rise. And suddenly we suffer from diarrhea, IBS, distension, constipation. Even nowadays they are relating this imbalance towards the development of cancer colon. Actually, there are many researchers from the 80s of the last century until now that it starts with an imbalance of the commensals and non-commensals and develops into IBD, IBS, and later on it ends with cancer colon.
Abuse of antibiotics.
Yes.
Please, for the record, and, you know, there's a common misconception. If you have a common flu, a common cold, you need to take antibiotics.
Yes.
Please answer this question.
No, of course. Usually we prescribe antibiotics when we have a major disorder, pneumonia, chest infection, fever, high fever, not responding to the usual antibiotics. No, and please, when you use the antibiotic, finish the whole course. Don't get the bacteria, the bad bacteria, to get introduced to the antibiotic and don't kill them. No, please, finish the whole course, even if you are okay and you are fine. And please, use the most specific antibiotic regarding your condition.
Yeah.
Consult a doctor and don't take it just like this. And regarding the doctor, please don't make the antibiotics like over the counter.
Yeah.
No, please. This is very specific, and we have certain guidelines regarding the usage of antibiotics.
Because we're talking about two different life forms, right? Every cold that we've ever had is not a bacteria.
Yes.
It's a virus. Is that correct?
It's viral, yeah.
So viruses are not impacted
Yes.
by antibiotics.
Only antibiotics are indicated when we have a complication, and this could happen when we have a bacterial overinfection with the virus.
Okay, very good. So now there's this issue of transplantation,
Yes.
right? The FMT, the fecal.
Microbiota transplantation.
Yes.
Yes.
What is this?
Okay, you've mentioned that we need to have like some supplements regarding the content of the bacteria. But the bad news that usually the stomach with its acidity destructs these bacteria. Actually, that photo, when they discovered the whole, they told it's our other genome. You know, the genome is the distribution of and the pattern of the genetics in our DNA. now they are considering our gut as a microbiome and the microbiome, because any differences in that, like what we say, like the genes, any disturbance in this could affect our health. Now there are many evidence linking the Alzheimer, for instance, with the disturbance in the microbiota. Can you imagine this?
Wow.
There are many evidence concerning the immune deficiency with the disturbance of
the stomach, the gut.
The gut, yes, the bacterial disturbances. But I do have a photo at the end with a blender and a fecal matter. Yes.
Yeah, we'll have a photo in a second of a blender, you said?
Yes, a blender with a fecal matter,
and we'll get that in a second. The brothers will get that ready for us.
Okay. Okay, but the trouble with taking the bacteria orally, that it's destructed from by the gastric acidity. And when we increase the dose, it could be harmful. Yeah? It's like an overdose of the bacteria. Nowadays, there is a concept of transferring these fecal matter from a healthy donor who is screened very well by laboratory examination and is leading a healthy lifestyle. And this donor could transfer it to another recipient who is suffering from an issue, okay? A GIT issue, obesity even issue, because we found that the pattern of bacterial distribution all over the gut is different from the obese and the thin ones.
But doctor, okay, here's a...
Okay, not this one. This is the Economist, when they discovered that had a cover that microbes makes the man, that your gut tells about your health. Your gut and disturbance in the gut could tell about the disturbance in your health. So actually, it's all about the gut. And maybe the old proverb in the Arab and the Islamic medicine that al-ma'da is bayt al-da', which states that the gut is the origin of the disease.
Or in the US, we have another one.
Yes.
You are what you eat.
Yeah, exactly, exactly. Because what you eat affects your microbial pattern. Okay, actually, there are two photos at the end of the PowerPoint describing the transformation itself. Okay, this is a transformation, as you see. The upper photo, this is from a colonoscopy, where we take, this is a healthy colonoscopy.
A healthy one.
Yes, when we transfer the fecal matter itself, which is loaded with healthy bacteria, and we transfer it at the gut that is found at the bottom of the photo. As you see, it's full of inflammations. This is a pseudomonas pseudoenterocolitis. It's caused by bacteria called Clostridium difficile.
All these little yellowish
yes, this
growths.
is a form of inflammation. So we transfer from that healthy gut to the unhealthy one. This is a fecal microbiota transplantation. After this one, there is another photo of the process itself. Actually, what we say, the yak factor. Okay. We do it by endoscopy. As an endoscopist, we take the endoscopy and bypass the stomach and start at the early part of the intestine and inject this fecal matter. That's how we escape the hyperacidity, the gastric acidity that may destruct these bacteria.
But Dr. Osama, I'm sorry to interrupt you.
Yes.
It seems like it's awfully complicated.
Yes.
Why can't the patient just eat more yogurt to promote the good health? Why do you have to go through transplanting from one person into another? Okay,
Ali, yes, this is totally different, okay? The yogurt is a prebiotic, is a probiotic. And let me tell you, even the fortified ones with lactobacillus and bifidobacillus, they are just two strains. When we are talking about the fecal, it's the whole package, okay? This is the yak factor we are talking. It's a blenderized to be like fluid, and this is, by the way, is done in the USA in one of the biggest universities there. It was done before in Harvard. It was done in many places. Actually, it was done and approved by the FDA.
So this machine is a picture. What is it? What is this machine? It blenderizes
the fecal matter from the healthy donor to be in that injection.
Ah, she's taking a syringe.
Yes, a sample. Yes. And later on, it's injected into the endoscopy, back into the gut of the recipient.
The suffering person.
Yeah, the recipient.
And
the
you said
unhealthy
that yogurt, eating yogurt is not enough because we're talking about
Sometimes
two
it's
different
not.
species.
Yes,
I
sometimes
see.
it's not. Yeah, and when you are taking antibiotics very often, you are destructing your commensal ones. Even they are not. It's not enough to help them to send them the prebiotic. No, it's not enough. You need to send them new species, new bacteria.
So in other words, you're saying it's like feeding grass to a dog. I mean, the dog's just not going to eat it.
Yeah, in a way.
In a way. Okay.
This one, it's how to prepare it. They are preparing it to be like fluid, and take care that it could be introduced by upper endoscopy into the intestine. It could be done by colonoscopy into the lower gut, and it could be done by enema. But take care that the water itself, the normal water, will destruct the bacteria. So it would be nonsense. You have to be processed in a professional way to be introduced viable.
Sterile water.
Sterile water and isotonic, not like the normal water.
Very careful operation.
Yes.
Okay, so unfortunately, some people have to go through this procedure of FMT, fecal
microbiota transplantation.
Transplantation. And what is the rate of success? People who undergo this transplantation, taking healthy bacteria from one person to another, what's the rate of success?
Okay, first let me tell you that it's FDA approved in the issue of Clostridium difficile infection. Clostridium difficile infection nowadays, it's very common, especially in the USA. The US department is spending $3,000 per patient as a consequences regarding the Clostridium difficile, the one who is infected with Clostridium difficile infection, and sometimes it leads to mortality.
This is an example of a condition where someone needs this transplant.
Yeah.
Okay.
We have like a guidelines. First step with an antibiotic, another step with another antibiotic. At the time, there is no solution except the fecal microbiota transplantation. There are, but as I'm telling you, that this is under the research umbrella. Still, we don't know what we are dealing with, but there are many researches, a successful one regarding using it in obesity, in immunity, in allergy. In IBS, actually, I had the privilege once of seeing a case of a boy, 18 years old, who had an extensive ulcerative colitis, and he was bleeding, and he had to do a colectomy, removing his colon. We did the fecal microbiota and transplant, and the bleeding stopped. And until now, 4 years ago, he's still having his colon totally intact and healthy.
And this material, these bacteria, the microbiota, are taken only from human beings. You can't take
Yes, it is. It's from a donor.
Okay.
And usually this donor is one of the relatives of the patient, a healthy one with an average BMI.
Wow. So this is cutting edge science.
Yes, it is. Yeah.
So, and they're
That's
treating
the future, actually.
the future, right?
Yes.
So we appreciate you being with us to explain this new cutting edge technique. You're saying, if I hear you correctly, that this procedure, transferring this healthy bacteria to a person who has an unhealthy gut, is solving more than just gut issues. There are all kinds of neurological issues and things like this that are being solved.
But this is still under research, but we have very good results until now.
Wow. So a very high rate of success.
Yes, until now, yeah.
Okay. All right. Well, we hope, inshallah, that you can continue. What about the donors? You said that the person who makes who does the donates their bacteria. Does it have to be a family member? What are the characteristics and the criteria?
It's better to be of the surrounding environment, one with an average BMI, a healthy lifestyle, thin, not obese. His labs should be done, and he should be free of any viral infection or something like this. He should not be, and this is logic, complaining from his gut regarding distension or diarrhea, should not be taking antibiotics, and so minimal exercise and willing.
Dr. Osama Fikri, he is a clinical nutritionist as well as a gastroenterologist. We appreciate you, doctor, for joining us to talk again about this cutting-edge medical science, transferring bacteria from one healthy person to a person who has a compromised gut. We will continue the program, Ramadan for better health, inshallah. We'll close out the program for now. Thank you for being with us. Assalamu alaikum wa rahmatullahi wa barakatuh.